Good evening, everyone, and welcome to the second program in our Humanities Speaker Series that's taking place this summer and fall. Our first talk on Cure Porch architecture and preservation with our Executive Director, Amy Catania, took place earlier this week. And this evening, it is my pleasure to introduce our next speaker, R.E. Fulton, who will be discussing the roles of women in medical history. R.E. was trained at Clarkson University and the University of Rochester in the history of science and culture in the United States. In 2017, they received a master's degree in American history and began seeking ways to tell the stories of women in history outside of the academy. Most recently, R.E. has worked as an interpretive educator at the Lower East Side Tenement Museum and an educator at a feminist medical history blog called Nursing Cleo. Before we get started, please note that this presentation is being recorded. We will share the recording with everyone who registered following the presentation. I'll just ask that everyone keep their mic muted until the Q&A section at the end, and at which point you can unmute to ask a question, or you can also just put your question in the chat, and I'm happy to read it aloud for you. So without further ado, I'm going to hand it over to R.E. and we will get started.
Great. Thank you so much. I'm really excited to be here. I've been studying medical history for a while, but I'm also excited to be here because I am from upstate New York and I don't often get to talk about sort of the history of that area. So very excited to talk to you today about the roles of women in medical history, which I think is one of the most interesting parts of medical history in the United States, because it's a very, very complex narrative. What we're going to be doing today is thinking about the ways that the different roles women have taken in medical care in the United States have changed over time. So even just thinking about kind of the broad subject of our talk, roles of women in medical history, when we think about the roles that women take in medicine, there's a lot of different things that might come to mind, right? Women can be nurses, women can be doctors, women can be patients. In Saranac Lake's history, with the cure of tuberculosis, we see women taking on this kind of medical adjacent role of running cure cottages, right? But one thing that a lot of the kind of traditional ideas about women in medicine have in common is that we see more often the idea that women will be nurses rather than doctors, that women will be in supportive and kind of nurturing roles rather than in authoritative roles. Now in the 21st century, of course, things are a little bit different, right? Women can be doctors, women can take on a wide variety of roles, and there's a kind of a general understanding that that's how things should be. But they weren't always that way. And the narrative and the story of how we get from a time when very few women were doctors to a time today when many women can have that as a profession, it's not a clear line. It's not, a story in which a couple of brave pioneers make the change and then the field opens up to everyone. What we're going to do today is look at the kind of circular route that women take in moving into roles in the medical field they previously weren't able to. And so to talk about that, we're going to focus later in the talk in the woman that you're seeing on the left of the screen here, Dr. Mary Edwards Walker, who was actually one of the first women in the United States to go to medical school and get an MD. And her story, I think, is very interesting because she is in some ways a kind of classic heroic figure, a pioneer in her field, but in other ways, she was not respected by many people at the time. And so it gives us a really cool example, I think, of looking at the way that every story of women in medical history really has two sides. But to start out, we're going to go back a ways in history. We're going to go back actually to kind of the beginning of US history, thinking about what women's roles were in medicine in the colonial era. This is an era when women, by and large, were not doctors. All doctors in the United States in the colonial era are going to be men. And women are not able to kind of get that role as a profession. But this doesn't mean that women aren't involved in medicine. In fact, women were really key to medicine in the colonial era because most medicine, particularly most routine medicine, wasn't really the province of doctors. Doctors in the colonial era were mainly part-time. Somebody who's working as a doctor usually has another job. Quite often they were politicians. The doctor for your town might also be the mayor most of the time. And so in this era, when we think about medicine, your first line of defense is actually not the doctor, it's your wife, it's your mother, it's the woman who lives down the street. That routine medical care is kind of folded into the expected domestic duties of women in the colonial era. And so for the most part, that role that women are taking in medicine is not a role where they are kind of working outside the household to support themselves. The exception is midwifery, which is one sort of section of the medical field that is primarily in the colonial era the province of women. And it's something that you can do not just in that kind of household capacity, but in fact, many midwives did work outside the home and make money in that way. All of this starts to change as we move into the 1820s and the 1830s, which are a really wild time for American medicine. So I want to show you, kind of break down the different kinds of medicine that are being practiced in this era of American history, right? Because today when we hear medicine, we think about sort of one big system, right? Doctors, hospitals, medical schools, they all have the same sort of body of knowledge and accepted practices. That's not the case in the 1820s and the 1830s. So what you're seeing on this slide is actually a breakdown of three of the main different types of medicine that were in popular use in the United States in the 1820s and 1830s. And we're going to kind of go left to right here talking about each of them. The first school of medicine that is in popular use during this time are a group of doctors who called themselves regulars, but I'm going to call them, for most of this talk, allopaths. And the reason for that is this. Even though these doctors at the time, right, used that word regular to refer to themselves, it's very easy to hear the word regular and think normal, like standard, the regular doctors, right? And that's not quite what we're looking at here, because the doctors who called themselves regulars at this time had treatment methods and understandings of disease that are far removed from what we would think of as regular medicine today. What unites them is the idea that they believe all disease comes from a common cause. And even more, what unites them is their membership in a kind of elite professional version of medicine. The allopaths are the first doctors to really say, we need to have a standardized medical curriculum in this country. We need to have licensing laws. We need to have standardized procedures for the profession so that people can trust us and our cures. The issue with the cures is that allopaths mainly use what are called heroic remedies, which basically means really intense remedies that are meant to cause kind of dramatic effects on the body. And this is because the logic behind allopathic medicine is that all disease, again, it comes from a common cause, and it comes from imbalances in the body. And so that's where you get the logic of treatments like bloodletting, because that's meant to sort of take away an excess of blood. It brings the system back into balance. That's going to relieve whatever is causing somebody difficulty. Another really popular remedy for allopaths is calomel, mercury chloride. This essentially gives people mercury poisoning. But one of the things that does is it causes a lot of drooling. And again, there's this sense that you're purging the body of something that's bad for it. You're bringing it back to a more balanced state. These are the doctors who are founding professional medical societies, who are really kind of representing the elite of the field. But they're not the only doctors in the country, and they're also not necessarily the doctors that people trust the most, the doctors that people are going to go to when they're sick. And so for that, we're going to look at some of these other groups. In the 1830s in particular, we see German immigrants bringing homeopathic medicine to the United States. Homeopathic medicine is very different in that rather than looking to kind of one big theoretical system to explain all of disease and treating based on that system, homeopaths really emphasize observing symptoms. They're not necessarily asking what causes this. They're asking what's wrong with this person. And in order to treat those symptoms, they use this doctrine of like cures like. So they will treat a patient with a small amount, a diluted solution of some substance that is believed to be kind of connected to that symptom. So for instance, let's say the patient presents with a lot of vomiting. The homeopath is maybe going to go into his little kit here and find a very small vial of perhaps an emetic substance and give a tiny amount of that in a diluted substance, in a diluted solution to the patient. That emphasis on treating symptoms rather than following a coherent philosophy of disease is what really distinguishes the homeopaths from the allopathic physicians. But these aren't the only two groups. We also have Thomsonians. And Thomsonian medicine is one of the weirdest parts of US medical history, I think. It's named after this guy named Samuel Thompson, who was a doctor, rather not a doctor, he was a doctor who was self-made, basically. He was actually the son of a farmer in New Hampshire. And one day in the 1820s, he's out on his father's farm. He sees this plant. It's pictured on the right there. It's called Lobelia inflata. And he notices the plant seems to have some interesting properties. And he says, well, I'd like to test this out. I'd like to do a little bit of an experiment, but he doesn't want to be his own guinea pig. So he finds a man working on his father's farm and he gives this man a little bit of the plant. Lobelia inflata is a very effective emetic. And so the man, promptly starts vomiting profusely, feels terrible for a few hours. And then later on, he tells Samuel Thompson, you know what? I actually feel great now. I feel better than I have in years. Samuel Thompson's conclusion is that lobelia is a magic plant. It can cure all kinds of things. And out of this weird little experiment, he develops a system of medicine that says, okay, all illness is caused by imbalances of heat, and the way to treat it is to purge the body and to give the patient steam baths, to give the patient cayenne pepper enemas, things that are really designed to treat an imbalance of that heat. That's what gives you health. Thomsonian medicine, which sounds pretty awful, right? If I was given a choice between having my blood let and having steam baths and cayenne pepper enemas, it would be a hard decision. But the reason that it's very, very appealing to a lot of Americans at this time is that Thompson's whole philosophy is that anybody can be their own physician. This is democratic medicine. This is a system of medicine that says you don't need to pay a guy who went to Harvard in order to treat whatever's wrong with you. You can buy this affordable book that Samuel Thompson sells. It'll explain everything you need to know in order to treat your own illnesses. And you can really take hold of sort of the tools of medicine. And this becomes really, really appealing, particularly in the 1830s, during the kind of what historians call the Jacksonian era, when Andrew Jackson kind of inspires the country with this idea of democracy, that anybody can do whatever they want to do. They can be whoever they want to be. Samuel Thompson says, you can also be your own physician. So we see in just these three forms of medicine that there's actually suddenly a lot of competition for authority in the medical field. There isn't a single agreed upon answer about who's really right about how disease operates. And this becomes a real problem for the kind of elite allopathic medical establishment in 1832. Because in 1832, cholera comes to the United States. And cholera is a new disease. Cholera is also a very, very scary disease. It spreads really rapidly, but it spreads randomly. Now we know that cholera is actually spread by contaminated water. But at the time, without that knowledge, all that doctors could say was that cholera seemed to just spring up in tiny little pockets. Somebody could be, a whole household could be dying on one street and the next street over would be fine. The disease didn't seem to follow any of the explanations that these schools of medicine had. But in particular, it was a real problem for the allopaths, for the doctors who were claiming that they were the sort of most intelligent, most skilled medical elite. It turns out that the only way to actually treat cholera is massive hydration. Bloodletting is kind of the opposite of what you want to do. All of the treatments, the heroic remedies that the allopaths are using, really are very bad at treating cholera. And while the Thomsonians and the homeopaths aren't a lot better, they're a little bit better at treating cholera. They're able to claim that they have a little bit more success. And what this means is that by the mid-19th century, by the 1840s and the 1850s, there's a massive crisis of confidence in the American medical establishment. And what this leads to in part is a movement for health reform. In the 1840s and in the 1850s, the idea of health reform and the idea that ordinary Americans, men and women, can and should be involved in their own medical care just becomes really, really popular. What you're seeing on the screen here are two different images related to some health reform movements during this period. On the right, we have a copy of the Water Cure Journal. The Water Cure is a kind of alternative medical therapy that becomes hugely popular, particularly in New York State in the 1850s especially. You go to Water Cure Town, you get steam baths, you get wrapped up in wet sheets, and all of these alternative treatments, which are much, much milder than the kinds of allopathic treatments that used to be seen as the norm. These are a way for you to take charge of your own health and also kind of have a vacation at the same time. This becomes very, very popular, particularly with middle-class women in the mid-19th century. And another really popular health movement that's being spearheaded in particular by women is the dress reform movement. So on the left here, you have an image of a woman in what's called the bloomer costume, which is a very specific outfit that has kind of a short skirt, wide billowy pants. This is promoted by dress reformers in the mid-1850s especially. It's named after an activist named Amelia Bloomer. And the logic behind this is that the kind of traditional clothing worn by women at this time, particularly as you move up the social scale, so middle class and especially upper class women, that clothing is very restrictive, it's very heavy. right? You have a corset that can actually crush your ribs in. And the layers of skirts and of hoops that a lot of women are wearing are up to 25 pounds of clothing that you're carrying on your body throughout the day. And so you have a lot of women in this era of health reform saying, actually, our clothing is a health problem. This is something that male doctors aren't really raising, in part probably because they aren't the ones wearing 25 pounds of clothes on their bodies. And so it's women who really step in and start raising this issue of the negative health effects of their clothing and proposing alternatives like the bloomer costume. So here in the mid 1800s, as the medical field becomes more complex and becomes full of all of these different sects, we see that activist is one of the roles that is kind of added to the roles available to women in the United States. But there are some women at this time who are not necessarily satisfied with that, who want to actually step into the most respected, most elite professional role of doctor. And so in the 1850s, we see this push for medical education for women. One of the first women to really become involved in this is Elizabeth Blackwell. I've got a photo of her on the left of the screen here. Elizabeth Blackwell was the first woman in the United States to go to medical school and to graduate with a medical degree. And she goes to a school in central New York, Geneva Medical College, in 1849. The fact that she's able to graduate with a medical degree is actually kind of an accident. Geneva Medical College was not the first medical school that Elizabeth Blackwell applied to. She had actually applied to a bunch of other schools and been rejected because she was a woman. But then she goes to Geneva, and at Geneva, for whatever reason, the administration doesn't want to turn her away. Maybe they're a little more reform-minded and they say, well, we don't want to look bad. Whatever their reasoning, rather than rejecting her application, they turn it over to the male student body for a vote. And the student body, either as a joke or just because they decided they maybe wanted to support her, they vote unanimously to accept Elizabeth Blackwell. So she enrolls in the school. Geneva Medical College immediately puts in place a policy that says no other women can come to our school. So we see, even in these elite institutions, even when people like Elizabeth Blackwell are able to get their foot in the door, there's resistance to it immediately afterwards. And let's talk for a minute about the logic behind this. Because we can talk very broadly about misogyny, about sexism, about discrimination, but why specifically is there resistance in this time period to women becoming doctors? And the logic that's most often given is that the role of doctor, and even the training necessary to become a doctor, is not good for women because it's going to dull their sensitivity. It's going to make them less nurturing. It's going to harden them. Women going into a lab and watching the dissection of a cadaver does not sit well with a lot of particularly medical men. You also have women at the time campaigning against this, saying, no, this is not an appropriate role for women to take on. Women can be involved in healthcare in other ways. They can be mothers, they can be nurses, but doctor is a role that they shouldn't take on. And it's not until the late 19th century that we see a large number of medical schools going co-ed and accepting women. In this time period, the field remains very, very narrow in terms of women's medical education. The first and for a very long time only medical school specifically for women was in Philadelphia. We've got a picture here on the right of the original building of the Female Medical College of Pennsylvania. It's founded in the 1850s by Quaker reformers. And again, for many years, this is the only institution that specifically educates women in allopathic medicine, in that kind of elite form of professional medicine. Now, I say it's the only school that educates women in allopathic medicine because what we find is that in this time period, the people pushing most strongly against women's entry into the field as doctors are your allopathic physicians. Other medical schools, homeopathic medical schools, botanical medical schools, schools that teach hydrotherapy, tend to be a little bit more open. And that is important as we turn to the woman of the evening, Dr. Mary Edwards Walker. She was one of the first women to attend medical school, but unlike Elizabeth Blackwell, she didn't go to an elite allopathic institution. She went to an alternative medical school, an eclectic school called Syracuse Medical University, no longer exists. And her life story, I think, is very interesting. So she was born actually in Oswego, New York. She comes from a family of reformers, a family that is kind of dedicated to what were the radical politics of the day. So for instance, she and her sisters grew up wearing pants. Their family had a farm, and Walker's parents say it's going to be easier for the girls to help out on the farm if they're wearing pants. So she comes out of this family and this context where she's being told she can do the things that her brothers are doing. When she gets to adulthood, she carries that perspective with her. So in 1855, she graduates from Syracuse Medical College, and she opens up a medical practice. She's not able to practice successfully on her own. She actually opens a joint practice with a male colleague who graduated from the same medical school. She marries him, in fact. Very shortly thereafter, the two of them get divorced. So it's not a long-lasting partnership, but it's the way that she's able to get her start in medicine. And not long after, she begins practicing medicine in central New York in the 1850s. Dr. Walker gets an incredible opportunity. And that opportunity, unfortunately, comes in the form of the Civil War. The Civil War, huge conflict. It's going to result in the highest death toll of any war in US history. But what that means for people in the medical field is opportunity. For doctors and surgeons, the Civil War means an opportunity to develop and practice new therapies, new treatments, new surgeries. And for Mary Edwards Walker, the Civil War means an opportunity to step into a role that previously was closed to women. And in fact, it's a role that's close to her at the start of the war. She goes to Washington in 1861 to try to get a position as a surgeon in the Union Army. And she is promptly turned away. They say, we will not let you be a surgeon, but they offer her a position as a nurse. Nurse is an accepted, more feminine, nurturing position for women. Surgeon, particularly a battlefield surgeon, this plays into those exact anxieties that many people had at the time, that being physicians would be dangerous to women's sensibilities. So the Army does not want her as a surgeon. They offer her a job as a nurse. Dr. Walker turns them down. She volunteers her services as a surgeon for no pay and works for free for the Union Army for 2 years before finally in 1863, she's given a post as contract acting assistant surgeon to the Union Army. She's the first woman in history to work as a surgeon for the US Army. The following year, 1864, she's captured by Confederates and held in prison for several months. And after her release in the last year of the war, she works not as a surgeon, but as a superintendent for a women's prison and then for an orphanage. So there's just this one brief year where the US Army pays Dr. Walker to work as a surgeon before really transitioning her back into a more nurturing, traditionally feminine role. But in recognition of her service, Dr. Walker was awarded at the end of the war the Congressional Medal of Honor. You'll see her wearing it in both of the photographs here. She's the first woman in history to receive that honor. After the Civil War, Dr. Walker's path changes. In the Civil War, we see her kind of at the peak of her career, taking advantage of this opportunity, stepping into an unprecedented role, and achieving the highest honor available for military service. After the war, rather than going back to medical practice, Dr. Walker becomes a writer and a lecturer. She talks about her experiences across the country, but she begins to become a figure of some ridicule, particularly among actually feminists of the time. And the reason for this is that she keeps wearing pants. So you see in the picture on the right, and that's taken a little bit later in her life, she's wearing a very masculine style of suit. By this time, by the late 1800s, we see that actually the mainstream feminist movement in the United States has kind of abandoned dress reform. They've moved away from this idea of dressing in a less traditionally feminine way for health or for political reasons. Dr. Walker continues to wear masculine clothing, but she says it's not really for a political motive. She just feels more comfortable wearing those clothes and also finds it more conducive to the work that she's doing. Right? This comes out of her experience in part in the Civil War. When you're a field surgeon in the US Army, heavy skirts get in the way. But this choice of Dr. Walker's really makes her a fringe figure in activist movements, even though she continues to be very involved in feminism. A lot of fellow feminists take issue with her choice because it's seen as kind of bad optics. It gives the movement a bad image. And in fact, there's some logic to that argument because Dr. Walker was arrested many, many times for wearing men's clothing. And so there's this disconnect between the movement that she's hoping to support and the needs of that movement for respectability. In 1917, 2 years before Walker's death, the US Army started making some changes, going back through the Medal of Honor rolls. And essentially they decided that too many had been awarded. Many of them, particularly in the Civil War. And they went back to Army policy in 1863 and determined that actually only people who were commissioned as officers were technically eligible for the Medal of Honor. So in 1917, Walker's Medal of Honor is revoked. She doesn't take this lightly. She really cares about this honor. And you'll see in this picture, she's still wearing that medal, even though to do so after it's been revoked is technically a felony. She spent the last couple years of her life advocating to get that recognition of her service back. And although she died before that happened, the Carter administration in 1977 restored her Medal of Honor, making her, to this day, the only woman in US history to receive the highest military honor available. So as we come to kind of the end here of Dr. Walker's story, I think what she gives us the opportunity to do is this. Rather than thinking about change in history as a linear process, right, where people advocate for greater equality, greater freedom, and then get it, we have to think about change as something that happens in a kind of one step forward, two steps back manner. Dr. Walker's only able to make the advances that she does because of a crisis. And she's only able to do so because she herself is already in a position of some privilege as a middle-class white woman. And when she is able to step into the new roles of doctor and surgeon, while in some ways she's able to get recognition, payment, and all of the other things that male physicians and surgeons get, she also gets a bad reputation. So I think that we really have an opportunity here to think about the complicated role that respectability politics play in the history of medicine. We're also looking at a woman who, even though she makes all of these advances, is not going to be followed by a lot of other women in those roles, not for a very long time. Throughout the late 19th century, the early 20th century, we see kind of a return to this narrative that there's only one way to practice medicine, and the best way, the right way, is to be a white man. In the late 19th century, the early 20th century, we see the restriction of medical practice from women, people of color, immigrants, anyone outside of that kind of central allopathic elite. And it's not until we see the civil rights movement and the second wave feminist movement in the late 20th century that we start to see a really active move towards equality in different roles in the medical field. So it's that combination of activism and chance, that combination of hard work and luck that gets people like Dr. Walker into positions that are unprecedented. And I think it's very interesting to kind of look at this history in the moment that we're in right now. Because if there's one thing that could be said about the years 2020 and 2021, it's that we're in a bit of a crisis when it comes to medicine. We're in a moment where we're thinking a lot more about our health, about the people who are responsible for it, including ourselves. And as we ask those questions of ourselves and of each other, I think one of the things that we can consider is where we want that story to lead, what the future we want for medicine is. So this is the end of my remarks. This is a subject that I would love to talk more about. So I'm really eager to hear any questions, things that you'd like to hear more about, or thoughts on anything that we've covered here today. And thank you all very much for coming.
Thank you. That was really fascinating. I have some notes scribbled down and things like that of patterns and things that I did not, had never quite put together. So I'll give a couple minutes, see if anybody wants to ask a question. Again, feel free to throw it in the chat if that's easier. We can read it from the chat. can also break the ice. I know we tend to be shy on Zoom, so I'm happy to break the ice with a question. I thought it was interesting. It seems obvious when you say it that the sort of elitist allopathic medicine, when it's sort of at its height, that's when women's access to being in the medical profession tends to be lower, and it kind of has that alternating fluctuation. But then, with the Thomsonian medicine and this idea of democratic medicine, everybody can be their own physician. Do you think that sort of like democratic medicine approach had a role in giving women more credibility in the medical field in terms of, caretaker roles and midwifery and things like that?
I think it did, right? I think that when we're looking at the history of medicine, particularly in the 19th century, we're looking at a story that's really about who we trust. And the thing about the question of who do we trust is that there are always multiple answers to that. Unless you literally only trust one person, right? You tend to have a lot of different places that you look to for different things. And so I think that's one of the things that makes this history complex, that, on the one hand, you have an allopathic medical establishment that's really trying to sort of solidify their professional role on the basis of scientific knowledge and a very specific version of scientific knowledge. But then you also have, right, this other thing that Americans value in addition to science. A lot of Americans value freedom, democracy, right? And so that's why Thomsonian medicine becomes so popular. And then I think when we put the sort of lens of gender onto that as well, a lot of the ways that kind of early female physicians actually argue for the inclusion of women in the medical profession is by falling back on traditional notions of gender and saying, actually, you're saying that it's not good for a woman to become a doctor because it'll dull her, maternal instincts. But actually, being a doctor is maybe the most natural expression of this sort of maternal nurturing instinct for care. So it's this contest of all of the different things that we value in each other, the different things that we trust, that leads both to the sort of entry of some women into the medical profession, and then this kind of push away from that towards a tightening of licensing procedures. So yeah, there's always like several different angles to what's happening here.
And then I guess like the next step in that question that I have is, it seems that a lot of the allopathic remedies were the most extreme, bloodletting, and the most sort of like visibly uncomfortable. I don't know how else to put that. And, so did that, do you see that as playing a role in the elitism that then follows with that particular field of practice, as opposed to some of the others that seem a little bit like more accessible and understandable to someone who's not part of that elite crowd? So I guess did that extremism of the treatment contribute to the elitism of that particular practice?
I think it did. I actually think the way you put that is really interesting, because there's a sense that they maybe have a little bit more of a job to convince people that they're right about medicine, right? If I've got one doctor saying, here, have this solution that's maybe going to taste a little bit weird, but it's not really going to do anything to you, that's homeopathic medicine. And I have this other doctor saying, I'm going to, drain your blood. I'm going to require more convincing from the second doctor. And so I think that is a part of why there's this really strong push to kind of shore up the authority of allopathic physicians, because frankly, like their remedies don't work very well and they're really unpleasant. And this is why one of the things that's actually a huge part of the mid-19th century push for sort of like stricter licensing laws and more restrictions on kind of alternative practitioners A huge part of that is actually a campaign by the American Medical Association against abortion. Because what happens in the mid-19th century is that allopathic physicians are kind of the first group in US history to argue that life begins at conception based on their sort of new scientific medical understanding of how pregnancy and conception work. And that becomes this really compelling opportunity to get the American public on their side, because the stakes of that are really high. If you say, my medical knowledge tells me that abortion is murder, people are going to get, pretty serious about it. And so that's a way for them to really appeal to the kind of morals, the emotions, the ideologies of Americans when they don't really have always appealing or effective therapies. So I think there's definitely an interplay of those things here. Yeah.
Thank you. Any questions from anyone else in the audience? Oh, we do. We have a question. Thank you for the fascinating talk. You had mentioned Dr. Walker's role as a writer and lecturer. What were her writings? Were her writings medical in nature, or were they political in any way?
Great question. So her writings, for the most part, were kind of autobiographical. Which is to say that they were both medical and political. I will say that more of her writing tended towards kind of political writing, feminist writing, and she wasn't very involved in, for instance, like medical research at this time. She moves away from the medical establishment, in part because there is a lot of animosity towards female physicians in medical societies at the time, in medical schools. And so, yeah, she finds, to the extent that she finds kind of professional acceptance anywhere, it is in the feminist movement. So more of her writings tend to be, in that vein.
Thank you for that question. Any other questions? I'm sure I could keep asking questions and like bringing up discussion points until we all are ready to slam our laptops closed, but do want to make sure if anyone else has questions or comments, just an interesting point, feel free to bring it up.
Do we know how Mary Edwards Walker was treated by her male colleagues during the Civil War, other than her own recollections? Is there other evidence? I mean, I'm sure that, a lot of women went on the speaking tours to find a way to make a living. So I just wondered if there was any other evidence besides her own of how she was treated.
That's a great question. And we don't have a ton. What we do have is there's a set of letters between her and one of her commanding officers from 1865 while she was the administrator for the women's prison. And basically the content of the letters indicates that her superior officer was basically getting complaints about her, that she was too strict, that she was too authoritative, that nobody at the prison liked her, which on the one hand, it's prison, nobody's having a good time. But there's this sense from these letters that she had a reputation for being a kind of very forbidding personality, that she was abrasive in some ways. We don't necessarily get a sense of, I guess, sort of the politics, basically, of that relationship, of whether the men she worked with respected her as a surgeon, whether they were opposed to her position in the army. what we see more is that kind of like personality coming through that's a little bit more negative. Yeah, good question.
Okay, well, it is nearly 7 o'clock. So if we have no more questions, I think we can go ahead and wrap up for the evening. So thank you everyone for attending, and thank you so much, Ari, for taking the time to give this presentation, sharing your research and knowledge. This was really, really interesting talk this evening. So thank you so much. And to everyone in our audience, be sure to check out the events page on our website for our next speaker in our Humanities series. That will be Danielle Spencer talking about narrative medicine. So thank you again, everyone, and have a great evening.
Thank you all.